Hi everybody, I'm Rebecca Abraham. I am the CEO and founder of Acute on Chronic, and I am a plant medicine nurse. And I'd like to thank Curaleaf for sponsoring this, and we are going to record this. If you don't catch it now, you could catch it later. So today what we're talking about is chronic pain, plant medicine, and various routes of administration. So what folks don't know about plant medicine is, did you know that there are about 13 different routes of administration to use for plant medicine? And when we're talking about plant medicine, we are talking about plants that you could buy at places like Curaleaf. So we just want to make the algorithm happy. So let's talk about chronic pain before we get into how to help with chronic pain and how plant medicine can help with that. Let's actually talk about some numbers. So 1 in 5 Americans actually have chronic pain. So some of you listening, this might actually be you. 20% of the population globally suffers from chronic pain. It's actually a really huge under-addressed public health issue, not just in America, but throughout the world. One of the most common causes of chronic pain is one of the most difficult to treat, and that's back pain. So there are about 1 in 5 Americans with chronic pain, and there are $560 billion per year spent on chronic pain. Untreated chronic pain is a huge problem, leads to loss of income, loss of socialization, mental health issues, loss of enjoyment out of life, is a financial burden on a lot of governments, is really stressful on caregivers and family members. So it's something that absolutely needs addressed, and globally we're not doing the best job of addressing it. So how do we figure out what to use for chronic pain, and kind of how did we get here? So the standard practice in medicine today is something called evidence-based practice. And so if you are a registered nurse watching, a physician, a PA, a nurse practitioner, you know all about evidence-based practice. It's kind of been what we use in medicine since about 2000. Evidence-based practice is based off of something called randomized control trials, RCTs for short, if you've ever read about this. And randomized control trials are quantitative studies, so that's when we use numbers. And what we get from these quantitative studies is we isolate for variables one by one, because we want to know exactly what the cause of effect is. To get evidence-based practice, we need many of these randomized control trials, and then we need about 20 years to implement, so it's not exactly the fastest process. So that's how we get from thinking that something works to actually trying it on various patients. So there's a big problem, though, with evidence-based practice that I'm going to get to. So chronic pain is already a problem, but it's a much bigger problem if you are a woman. It's a bigger problem if you are a person who is a Black woman, if you are a Black man, if you are from the Latinx community, Asian men and women. All of these different subgroups have undertreated pain, and that is on the outpatient side and on the inpatient side as well. So a lot of what I'm going to be talking about is how to address that on the outpatient side, but my note about that from the inpatient side is caregivers, we have to do a lot better. The reason why we have to do better is because we have to take people at their word, and if somebody says they're in pain, even if they're not showing the right subjective or objective signs, I fully believe it is our duty to take those people seriously. So on the inpatient, we have a lot of work to do about taking people in their pain seriously. Always get the pain medicine on time, of course. And on the outpatient side, this is where plant-based medicine comes in handy quite a bit. So remember what I said about evidence-based practice takes about 20 years to implement. So part of the reason why people's pain is undertreated is a lot of women have a lot of undiagnosed pain. And evidence-based practice is mostly done on white, cisgendered, Northern European men between the ages of 25 and 60. Not a lot of other people are really included in that subgroup, so truly we do not know what helps a lot of these different populations. We know exactly what treats Northern European males between the ages of 25 and 65, but not really for anyone else. So what do we look for instead, and how does this have to do with plant-based medicine? Is there's a different paradigm that all of us in healthcare should be looking at and patients should be pushing for. Of course, we should keep evidence-based practice and randomized control trials, because that does give us a lot of valuable information, but there's something called practice-based evidence, and we do this all the time in nursing. We did it with COVID. So practice-based evidence is when nurses do something and we see a result, and we know what that result is, and so we try it again, and then we see that result again. This is really important to plant medicine, and this is actually where we get a lot of data from. In plant-based medicine, what happens is we get this practice-based evidence, and then later researchers say, there might be a there, and then they study it. So this is what we see in plant medicine. So treatment for chronic pain is a multidisciplinary approach. That's what makes plant-based medicine a really good addition to other things we should be trying. So what do we use to treat chronic pain, and what should be the entire cascade of what we use? What we should be using is, we should use mental health support services like therapy. There are studies that show therapy with pharmaceuticals and plant-based medicine and other non-pharmacological modalities is really, really helpful. Non-pharmacological modalities that are really helpful is acupuncture. There was a study with sickle cell patients where they did acupuncture. They had a pretty significant decrease in pain. Things like massage, art therapy, music therapy, all of those things are really helpful. Hot and cold therapy. But then there's pharmaceuticals. There is a place for your NSAIDs, that's non-steroidal anti-inflammatory drugs. Various other drugs, drugs that change the perception of pain for neuropathic pain, drugs like salicylic acid, which also is a blood thinner. We don't really know how it works, but it comes from a tree, so technically salicylic acid is actually plant-based medicine. That's how we discovered it, and there's actually a lot of things that come from plants that have been synthesized in pharmaceuticals, and this is where plant-based medicine really can help. So plant-based medicine can be in addition to other modalities like pharmaceuticals, but a lot of folks really strive to decrease pharmaceutical use and only use plant-based medicine. And there's reasons for that. Overall, plant-based medicine and cannabis actually has a very, very pretty safe side effect profile. Really good safety profile, side effects for all cannabinoids. So we're talking CBD, CBG, all of them. There's 162, are pretty mild. It includes low blood pressure, sleepiness, and sometimes dehydration, sometimes a little bit of dizziness. The reason why is, so I'm going to use my hand. So our blood vessels, they look like this. Cannabis does something called vasodilation. So what that is it opens them wide up. When you open your veins and your arteries up, that can cause a little bit of dehydration. That's why people feel dry mouth, dry eyes. But those are all very, side effects that are very tolerable. THC is the only cannabinoid with a little more side effects. That's where you get euphoria, which is a side effect but a good thing. Appetite stimulation, so side effect but a good thing. Sometimes, if you overconsume, you can get a little bit of anxiety, but the good news about that, it's not forever, it does come to an end. And so what we're talking about today, routes of administration. Routes of administration matter for how they will affect your pain, how they will work, and the side effects that you can anticipate with those. So first I want to talk about really briefly is the multiple cannabinoids that exist. And I have this. So there's 162, like I said, right? So you have CBD, THC, CBG, THCA, CBDA, THCV, CBC. You also have CBDV and a bunch more. So these all come in different routes of administration. There's 13 total. And how you use them really can affect how long it lasts, how you feel. So to break this down, I'm going to start with edibles. This is oral consumption, and oral consumption is actually some of the strongest ways that you can consume cannabis. Why is it strong? So there's a couple different things you could try for oral administration. So we have edibles. This is one of the questions I get the most from older adults. Your gummies, cookies, baking things, olive oil. And then you have beverages. So why is this the strongest? So what happens is it's the strongest. So when you take an edible, it takes about 1 to 2 hours to kick in. So you have to be kind of in for the night. Could last up to 4 hours, max 12 hours is what's typically seen. However, there have been some case studies in older adults, so that's over the age of 65, as well as people with liver dysfunction, that may have much longer times altered and have euphoria on a THC edible. We have recorded somewhere between 3 and 4 days. So that would be a very high dose of a THC edible in somebody who either is very up in years or has a very kind of slow liver. And there's tests we can do to figure out whose liver is functioning at normal speed or a slower speed. So why is this the strongest? So when we consume edibles, goes to our stomach. What happens then? Our stomach absorbs it, the acid takes it away, goes to our liver to be processed. So within the liver, we have an entire enzyme system that's really complicated that breaks down various things. Like folks who are lactose intolerant, they lack the enzyme that breaks down lactose. So we do have enzymes called the cytochrome P450 system. There's about 9 enzymes that really do the most work there, and they break down the edibles. So what happens when they go through that system is your THC delta 9, that's what you inhale when you smoke, actually gets converted to THC delta hydroxy 11. And that's a little stronger. Then it goes through your bloodstream. And then eventually in 4 to 12 hours, it is out and you are back to normal. And actually, because cannabis is something called lipophilic, it stays within your fat cells. So then there is an added benefit. Oftentimes we see folks not only get something immediate for pain relief, but something that is goes on longer and is much longer standing because it stays in those fat cells. So stronger, long onset, stays for a while. I oftentimes recommend using these at nighttime. Drinks, on the other hand, cannabis drinks are becoming much more popular. There's a lot of utility there. So drinks don't seem to get people as hard as the gummies or the cookies or brownies do. Drinks seem to be a little lighter. They still change over to that delta hydroxy 11, but they're a little lighter. So if you're first starting out and you have pain that you want to control, drinks are amazing. What's also a benefit of drinks, and if anybody is watching where you are a producer, and they're drinks can be really useful for people with G-tubes, people at the end of life who really can't eat anymore, people who are nauseous. They seem to go in easier. They don't clog up the G-tube. The problem with gummies and cookies and even oils is if somebody has a G-tube or an NG tube, so that is a hole in your, a tube that goes through your stomach or something that goes through your nose. You don't want to clog those up. It's an entire day in the hospital to get a new one, and it's a procedure with anesthesia. So drinks are my number one choice for folks who have a G-tube or an NG tube or a J-tube. Other routes of administration, so of course vaporizing and smoking, inhalation. So there's a benefit here too. So if you smoke flower, that is going to be a little more potent than your vaporization, even though the percentage could be higher when you're looking at something. And usually THC in the flower is usually around 20 to 30%. It does hit stronger. That is because you are getting the full spectrum of the flower. And I actually have a study that I'm going to talk about later that explains kind of why. THC works a lot better when it comes with its friends CBD, CBG, and full spectrum. So when you're smoking flower, you're actually getting all the terpenes, you're getting all the cannabinoids that are in there. And it showed a pretty good effect with everything mixed together. So that's one of the reasons why that modality is actually really powerful. But vaporizing has its use too. Both of these very quick onset. So when you vaporize or smoke, you usually feel the effects of this within 5 to 20 minutes max. So I always recommend starting to take one puff and then wait 5 minutes, 15 if you're a new user, try again. Only lasts anywhere from 2 to 4 hours. So what's nice is if somebody has pain and they wake up in the middle of the night and they don't have the 6 to 12 hour buy-in to use an edible, this is where it's great because you know it's going to be out of your system within 2 to 3 hours too. So that's another route of administration. Other benefits is there are some studies that show for folks again with GI cancers, this really helps them eat a lot more because you don't really want to time an edible when you have no appetite or chemo's making things taste weird. So it's sometimes nice to be able to know exactly how long something's going to take to affect you. Also, if you have chronic pain and it hurts to eat, oftentimes you don't want to put anything in your stomach that's going to agitate it. So that's where the vaporization and smoking can really help. Another route of administration is topicals. So what I love about topicals and creams is this doesn't go into the bloodstream. So this is a really great, safe product to try for somebody very new to cannabis, for perhaps an older adult, again, those over 65 who are very scared. What's great about this is it doesn't go in your bloodstream and there's really no risk of being altered, so no euphoria. It does work. So a study in 2020 showed that we have cannabinoid receptors. So our entire body has something called the endocannabinoid system, lives within our central nervous system. So our central nervous system is why we have pain in the first place. So it makes sense that cannabis can help. The endocannabinoid system is within our central nervous system. Our central nervous system is kind of where all of our pain processes comes from. It's a protective mechanism of our body to tell us if our hand is on fire, to move it, if something is crushing us, to go away. But chronic pain is a disorder because when the initial injury is gone, we're not really sure why that chronic pain stays around. So creams are great because we have these receptors topically. They don't go to the bloodstream and there's a significant amount of relief. The other really great thing about creams is it's kind of an intro to THC because you know it's not going to the bloodstream. And so you could have somebody try THC and have them not be frightened in any way. Another modality is oils. So what I love about sublingual oils is they remain THC delta 9 just like the vaporization and the smoking. So sublingual oils are amazing because you could put them under your tongue. There are some that are made in a way where you can mix them in drinks, smoothies, water. So the composition will indeed remain the same. The only thing that's kind of tricky about sublinguals is sometimes the dosing. You have to get really accurate dosing because a little too much and you can have a little too many of those side effects, get a little too dehydrated. So sublinguals are great. This is where we also see things like RSO. RSO is actually slang for full extract cannabis oil. RSO is Rick Simpson oil, but full extract cannabis oil does keep all the cannabinoids as well as all the terpenes in it. So that's what's really great about some of the sublinguals is you get all those compositions, and like that study said, it can really help when they all work together. There are other forms of sublinguals. Distillate is a different kind. What distillate is it just kind of pulls out the cannabinoid of your choice. So that's THC, that's CBD. So no, distillate typically, unless there are other added things, doesn't include the THC or the CBD. Other modalities are patches. So patches are kind of the new kid on the block. Another really safe entry-level way to introduce somebody with chronic pain to cannabis. These do go to the bloodstream, very similar to other patches you may have seen as the outpatient or in the hospital. So the patches, you have to put them in very specific places to get to the bloodstream. So you don't want to put them over the area of where you have pain. That does work for some people, but not everyone. Where you want to put them is on your wrist, where you have a lot of blood flow, or on the top of your foot. These patches work within 15 minutes and last for about 12 hours. What's really nice is if you use a patch with THC, you could rip it off. And then the side effects go away within 20 minutes. So if you're euphoric, if you have side effects, if you don't like how you're feeling, or if you just need to move on with your day, or you changed your mind, there is an exit plan. You could just rip it off and be on your way, which is really, really nice. I didn't mention how long creams last. Creams typically work starting immediately within 5 to 15 minutes, and creams typically can also last anywhere from 8 to 12 hours. The next modality is, I'm talking about now the less used ones, is IV and suppositories. I'll talk about them together. So IV, this is really just used in studies. It is happening in some research. Pretty cool things are happening. This one we may see in the future, not quite yet. Like I said, the endocannabinoid system does work in our central nervous system. It does affect neurotransmitters. So if I were to bet money, I bet we may be seeing IV cannabis and plant medicine in our future in the hospital. Of course, then it would likely be synthesized because you have to make IVs a certain way. However, I do think there's probably a lot of potential there because cannabis affects things like serotonin, dopamine, GABA receptors. These are all really important when talking about pain, relaxation, anxiety, and a lot of the other cascades we see in chronic pain. And already, I'm a former ICU nurse, so we give people dopamine to keep their blood pressure up. We give people norepinephrine, that's another neurotransmitter. We give them that to keep their blood pressure up. So what we know about cannabis so far in some studies is it does cause hypotension in some people. Some people it causes hypertension, but I always advise to watch your blood pressure. Sometimes this hypotension could be a really good thing. I have seen many people with hypertension be able to regulate their blood pressure when using plant-based medicine for pain. There's 2 reasons for that, actually probably 3. The first one might be the vasodilation. That's one way we bring down our blood pressure. The other way that cannabis may work to reduce blood pressure in people with chronic pain might be just helping with their pain. When we have pain, our blood pressure goes up. It's one of the objective signs that we use to tell that somebody's in pain. The other way is relaxation. When you use cannabis, you become relaxed, and that also helps with pain control too. So IV, not here yet, the future, only in studies. And then suppositories. So this is an important one. So a lot of patients using plant medicine to help with pain control typically make their own suppositories, which could be great. And I'll talk about what we can do with flower. Flower is, if you're not inhaling it, there's actually a couple of ways to use flower to help control chronic pain. But suppositories, so that's one way you could use flowers. You can make your own vaginal or rectal suppositories. But these sometimes are pre-made for you, either with CBD or THC are the most prominent, sometimes a mix. Suppositories, always check with your doctor, a nurse, or a cannabis clinician prior to using this. Why? So suppositories, if you have cancer, if you are immunocompromised, if you have a low platelet count, if you have something called neutropenia, that's where your a part of your white blood cell count that fights infection is low. If you use a suppository and some of those laboratory numbers are off, you can get the translocation of bacteria from your gut, and you do not want that in your bloodstream. So before using suppositories, always check with a cannabis nurse or a cannabis clinician, a cannabis doctor, or just your regular physician or a regular nurse. With vaginal suppositories, we seem to think that there's some localized relief. There are a couple studies that talk about this for abdominal pain, menstrual cramps, menopause symptoms, post-operative and painful sex. vaginal suppositories have been known in some studies, mostly preclinical, and then some patient testimonials and case studies to help. Rectal suppositories, there's only 1 to 2 studies to actually show us anything. What likely is the case is there's probably a lot of localized pain control. But there may be systemic and vaginal. There is a high suspicion that this is systemic, more so than rectal. So suppositories are another great modality. And then I want to talk about interthecal and flour. So interthecal is another one we just see in just a couple of global studies, but if you've ever heard of traumatic brain injury, and there's usually a lot of symptoms that go on long after the initial insult, as well as significant chronic pain, as I did see one study where somebody had a TBI or a traumatic fracture to their spinal cord or something within their neurologic, within their spinal cord, their brain, and interthecally, when they were given cannabis in this particular study that I believe is just a year old, they actually had some symptom relief. So another one, we're not here yet. Again, it would be synthesized probably, but the future, perhaps interthecal administration, which would be pretty interesting. And then there is flour. So I said flour, besides inhaling, what else can we do with flour? Quite a bit. So flour, remember how I talked about there's many, many, many different routes of administration and different cannabinoids. So THCA is flour when we don't set it on fire. CBDA is hemp flour when we don't set it on fire. So what can flour do for us? So that THCA is actually really great in many studies, many of them preclinical. So preclinical, what does that mean? That means that it was done on a test tube or an animal, and we don't have enough data to say yet on humans. But preclinically, THCA helps reduce things like migraines. It could help with pain. Particularly, we see some pretty interesting things in data regarding cancer pain. So how would you consume this? Making it into a tea is something really great, but not too high, because if you turn that temperature up too high to boiling point, you will turn it into THC. But turning it into kind of a lukewarm tea, if you just mix it into a smoothie, I often recommend you take this in a grinder and you grind it up. It looks like it's mold at the bottom. It's not. It's actually really good for you. It's called keef, and there's a lot of things in there. The trichomes, there's a lot of terpenes. It's really, really good. So grind flour up, sprinkle it over yogurt. The residual when you grind flour up, it's not trash, it's not bad for you, it's actually quite good. There is no alteration, there's no euphoria that comes with it, which makes THCA quite a nice cannabinoid to use because you can use it during the day. And flour is a really great way to get that THCA because sometimes it's a little, it's not really made often into a sublingual oil. And then in regards to women's pain, women in particular, with their menstrual cycle as well as life cycle. So life cycle makes a difference. So if you have pain and you are a woman who is over the age of 65, you may need to consume a little more cannabis to have the desired effect. Why? Our hormones change how THC makes us feel, as well as CBD, but also we have less receptors. Some of them decrease, some of them kind of burn out. We see this in different parts of the body with older adults. Our thalamus, what makes our immune response. If you've ever heard of T cells, our thalamus makes T cells. And in a study I'm going to talk about, cannabis does have quite a bit of properties that help with anti-inflammation, which is one of the reasons we have pain, but also it could be a pro-inflammatory. So pro-inflammatory is stimulating our immune response, and cannabis is biphasic, so cannabis can do both, which is really cool. So if you're an older adult and you're not producing as many T cells, there are some studies that kind of show this anti-inflammatory and perhaps a pro-inflammatory effect. But other parts of the life cycle for women that matter. So your period will actually make how you feel when you consume plant medicine or cannabis very different. When you are ovulating, you will need less THC to get euphoric. It seems to become more potent, and then that that week before your period, you have a drop, typically in estrogen, I believe, and an increase in progesterone, which makes you need to consume more THC. So life cycle matters. If you are perimenopausal or menopausal, what is happening again in those preclinical studies for pain and symptoms is we typically see that sometimes CBD is better used in the morning time. So timing matters with cannabis care and plant-based medicine, life cycle matters, and then what is going on that is causing your chronic pain. So typically chronic pain is caused by a couple of different things. Some of them we don't quite understand yet, which is why chronic pain is so undertreated and so prevalent in the global society at 20%, and then 1 in 5 Americans here in the US. Ways we have chronic pain. So in an inflammatory process, so we have this really great robust immune system that targets foreign bodies, right? So if you were to eat something off the floor that had a lot of germs on it, your body knows to tag those germs and get them. They're called antigens. We make antibodies ourselves and it gets them, right? That's the inflammatory response. It's really more complicated than that. We have things like interleukins and phagocytes. Those are the Pac-Man of our immune system, but it's triggered, right? So what happens sometimes in chronic pain and things like rheumatoid arthritis and other disease processes is sometimes essentially that immune system goes a little haywire and starts becoming inflamed when there's no antigen and there's no foreign body present. So the body begins kind of going after itself. And I'm making this really basic, so if you are a person of science and you're listening, I'm really I'm kind of giving the cliff notes of the inflammatory process, but that's one way we have pain. And now I'm going to begin the part where I start citing studies. So we do see in Henshaw et al. 2021, they did a systemic review, so they looked at 22 studies that showed a pretty good anti-inflammatory response. So what that tells us, 22 studies say that cannabis perhaps can help chronic pain and with inflammatory pain. In that same study, so Henshaw et al. 2021, shout out to fellow researchers and science people, they also showed one study that helped good reduction in neuropathic pain. So what the heck is neuropathic pain? That's when we have pain, and it's like a tingly pain. It seems to be more of a nerve pain. Oftentimes, if you were to break your arm and damage that nerve or sever a nerve or have a crush injury, so you're in a car accident, your nerves are crushed, what happens then is the nerve is damaged, it's severed, it gets compressed, and it starts sending really wacky messaging back and forth. In that Henshaw et al. Study, THC was showed to reduce neuropathic pain in one study alone, but we see in those 22 studies of that particular systemic review that all cannabinoids working together was the most beneficial for treatment modalities. So that's the second type of pain, is neuropathic pain. The other type of pain is what I like to call functional pain. So functional pain and sometimes neuropathic and chronic pain can be part of this too, but there oftentimes are patients who say that they are in pain, and the diagnostic tests that we have today, your CT scans, your MRIs, your x-rays, your ultrasounds, your blood work, it doesn't show any abnormalities. So these are the folks who sometimes stay and have chronic pain for quite a bit, is because in modern healthcare, we're taught that if somebody has pain, it will typically show on a test. And we know from people suffering from fibromyalgia, chronic non-malignant pain syndrome, that this isn't always the case. So that's another pain that we see happening quite a bit. So where can plant medicine come and really help folks out here? There is a theory that some folks do not make enough endocannabinoids. So we make our own endocannabinoids, just like we make our own antibiotics. How I said that we produce an antibody. So what is penicillin? Antibiotics, it's a synthetic, sometimes from a plant, sometimes made in a lab, version of that antibody. So what's really cool is we have endogenous cannabinoids. So there is a theory that some people are deficient in those, and what could help is the plant, is we add those compounds back in and it fills back up those receptors. So that is another kind of theory that's out there. We have a long way to go until we prove that, of course, but it certainly gives hope to a lot of people who have been suffering. I actually just read a study yesterday, a 2021 study, talking about there's something called Ehlers-Danlos syndrome, where you have very hyperflexibility. Your limbs kind of move all over the place, and a lot of times when I've helped these patients, I very much often see that tied to some pain, fibromyalgia, as well as something called POTS syndrome. POTS syndrome is where you have a dysregulated autonomic nervous system. So, when you exercise, your blood pressure, your heart rate goes down when it should goes up, and everything doesn't go as it should. So we see folks with this kind of three-part cascade, and a study that just came out, I just read it yesterday, said as much. And those folks, that is where cannabis, I have seen, again, this is not a study, but in my own practice, cannabis has helped them quite a bit in plant medicine, and that's a very functional cause of chronic pain. So what else is there to say about chronic pain? So some really cool studies. So in a very recent study, so this is 2022, Mangual Perez et al. Did a study of chronic pain in 213 patients, and out of those 213 patients, 89% said that they felt like medical cannabis was significantly more effective than narcotics. So I'm always trying, when I work in the field, I'm always trying to encourage physicians to not use cannabis or plant medicine as their last choice, but perhaps move it up in the order as an earlier choice. Why? I talked about the really great safety profile, and as we see, this study group, granted, we need more of these to prove it, which is great. We want science to be proved, but we do have robust patient data where people report that cannabis and plant medicine has significantly helped. Also in this study, so in medicine, we often use the 1 to 10 scale to rate your pain. A note about that: if you're in pain, say the number. Again, healthcare people believe this number. It doesn't matter if somebody, they're saying they're a 9, but I think they're a 5. Who cares? If they're a 9, let them be a 9. The opioid crisis kind of didn't do any favors for anybody, not the patients, not the practitioners, nobody. So take people at their word. So you take that scale, right? And in kids, it is called the Wong-Baker scale. There's different smiley faces. In that same study in 2022, there was a 4.47 reduction in pain on that 10-point scale. So that means that if somebody said that they had a 10 out of 10 pain, an average amount of patients in that study ended up with a 5 out of 10 pain. That's pretty significant. Other really cool studies about plant medicine and chronic pain is Bonke et al. 2016, when folks use plant-based medicine or cannabis to help with chronic pain, there is a 64% reduction in opioid use. So when I talk about chronic pain, I kind of go on this diatribe about how back when I was in nursing school, we were told pain is the 5th vital sign. Tell people that they cannot get addicted to opioids. We now know that that actually was based off of a 1,000-word letter produced by one person that was repeatedly published, and that was propagated by a certain pharmaceutical company to increase opioid use. The good news is we were being more aggressive about treating chronic pain. The bad news is perhaps too much. Now that we had the opioid crisis and we see this paradigm shift, we have a problem. We are not treating people's chronic pain appropriately. Nobody seems to care about that pain score anymore, and it's really hard for patients to get access to any type of pain medicine, especially opioids. So a lot of people assume that the opioid crisis is people who intentionally were misusing opioids. that is not the case. What happened is we were tossing opioids at everybody, and people had true pain and they got addicted, not because they wanted to, but because they had true chronic pain. We now took those away, and people don't have much to go off of for pain. So sometimes there's NSAIDs, sometimes steroids, sometimes a couple of these different newer drugs that are out there for neuropathic pain. But one physician told me that they have kind of 3 classes of drugs to give, and after that there's nothing to offer them. So they start offering cannabis and having folks call cannabis clinicians. So that reduction in opioid use does matter because opioids are hard to get if you have chronic pain. And then if plant medicine is helping that chronic pain, you don't need the opioids anymore. Another really cool study, so if you're out there and your municipality is pushing back against opening any sort of plant-based medicine, anything, Sue and Kovat's 2021 showed that when a municipality or a local county increased from 1 dispensary to 2 dispensaries, that there is a 17% reduction in mortality. So mortality is how many people are dying. A 17% reduction in mortality is big. So we really see the effects there. So those are some really cool studies. There are a small but mighty group of us. Does anybody have any questions? And I'm also going to check the time really fast because I've been talking for a while. And I'm going to click to check the time. Any questions? There's no bad questions. But as you can see, plant medicine can be a really great way to help with chronic pain. It certainly has a fantastic safety profile. It can be used safely with other pharmaceuticals, but always check with your physician, your provider, a cannabis clinician or cannabis nurse to be sure you're safe. There's only about 5 exceptions to that rule, so very few. So, always double check about drug interactions, because remember how I mentioned how everything is metabolized in the liver, so is everything else, including pharmaceuticals. Sometimes if you are using plant medicine, if you increase another pharmaceutical that you're on and you notice that that plant medicine has not been as effective, it could be because it's blocking up that enzyme and not allowing the cannabis to be metabolized. So always kind of think about that and talk to somebody who could kind of run that checklist for you. Is there any form that does not leave such a dry mouth? This is a very good question. I would say the beverages, kind of getting a 2-for-1, so you're drinking, you're staying hydrated, but also the cannabinoids are going to do what they do, so they're all going to vasodilate and they're all going to cause a little bit of dehydration. So I would say the beverages are the best there. The other thing you can do to help with dry mouth and dry eyes is saline eye drops if you have dry eyes. But for a dry mouth, biotin oftentimes works pretty well. And then also just staying hydrated. So a way to mitigate a lot of side effects from cannabis is literally just staying hydrated. If you drink water, if you drink electrolytes, coconut water, that's gonna, when you vasodilate, it's gonna keep a lot of blood and fluids flowing. So that's a really good way to prevent dry mouth. And then eye drops to prevent dry eyes, as we're talking about. Also suppositories and painful sex and symptoms from menstrual cramps and what have you. The really fascinating thing is there was a study in, I believe, 2018 by Sun et al. She does a lot of the sexual health and cannabis research. Really cool. So all of our tissue, epithelial tissue that's in our mouth, our nose, and our other body parts, including our vagina. It's all the same tissue, and what's interesting is cannabis dries out our mouth and our eyes and all of that epithelial tissue, but not vaginal secretions. So You can absolutely use cannabis for any kind of chronic pain or chronic pain with sex because it actually doesn't do that. So it's another reason why it's a super cool plant. Any other questions? And I am going to record this and do clips of it later on Instagram. And thank you to Curaleaf again for sponsoring this. And so if you want to find more of this, you can follow us on TikTok, Acute Chronic RN, and then follow us on Instagram. We try to do as much education as possible. If you have chronic pain and you want us to reach out to your physician, we are absolutely happy to do that and do lunch and learns. We try to educate everyone from the cannabis industry to physicians, and we try to advocate real hard for patients. Even if you are a chronic pain patient and you are not interested in cannabis, although you should definitely give it a try, particularly the creams, particularly those other cannabinoids, CBD, CBG. We are also happy to do patient advocacy and advocate for you because we know that chronic pain is very real and very undertreated all across inpatient, outpatient. It doesn't matter. It's a huge global problem. So I see another question. So it's hard to answer specific questions on cannabis, and here's why. So when my nurses work, when we have patients, when physicians send us patients and we collaborate, cannabis really, really, really is very individualized for all patients. How we get the results we do. So at my company, Acute on Chronic, we track statistically who's getting help and who isn't. And we actually have a 90% plus success rate in controlling symptoms, either mildly or to complete symptom relief. And so, can I promise that we're going to take everybody's pain away? No. Can I promise some sort of relief like we see in this 2022 study out of Puerto Rico where there was a reduction in pain scale? Yes, that is what I see most often, but how do we get it? And there's no one-size-fits-all formula. So what we do, what our team does, is we actually use the nursing process. So the nursing process, if you've been to nursing school, you know that this is a little bit of an outdated process. We don't really need it anymore with pharmaceuticals, but you goal set, you do education, you do an assessment, you do an intervention, and you say the rationale, and you start over again until you solve your goal. We do that. So we use the nursing process, we do a complete assessment, we do really robust education, and then we do a literature review. So all of the studies, you could see my scratch paper, all of the studies that I found is something that we typically do for every single patient. So we really hone in specifically on the individual. And we go from there. Some patients that we have seen have complete relief within 5 appointments. Some stay with us for 9 appointments and have moderate relief. So it all really depends. And what is the magic formula? So we have a couple of case studies that are peer-reviewed and presented at medical conferences. And I'm always getting the question like, can I try this also for I have the same syndrome? And the answer is no. And the reason is because it really does take kind of looking specifically at how you metabolize things, what's your height, what's your weight, what do you eat every day, what other medicines are you taking, and we really do see a vast difference in what helps people. With chronic pain in particular, let's take fibromyalgia, no one formula is the same, so sometimes I see a really great result with CBG, sometimes I see a really great result with CBD or CBDA. Back pain, same thing. I have one particular patient who had a complete symptom resolution with CBDA, that's it. And then I have another patient with the exact same thing who is on 3 different products of different cannabinoids. So know that it really is individual, but definitely reach out to a cannabis clinician. So where can you find us? So we're www.acuteonchronic.com. Please follow us on Instagram. Please tell other people to follow us on Instagram. Go to our TikTok, go to our Facebook page, Acute on Chronic, go to our Twitter, Acute on Chronic. We try to speak as much as we can anywhere, conferences in the industry and healthcare, trying to bridge the gap between healthcare and cannabis. We are located in Illinois, but we do see patients in all 50 states because hemp is available in all 50 states. So we can do CBD, CBG, titration in various states. Perhaps some other countries, we have had some interest in Canadian patients as well as Israeli patients, which is awesome. So we are based in Illinois, but we do have nurses in New York. We do have nurses coming soon to California. And we do see patients everywhere. And we do virtual appointments in person. If we have a nurse in your state, we're trying to get one in every single state. And we also try to do home visits. We do see people in Florida. We work with amazing physicians, and we can do medical cards in, I believe, 17 states now. So please follow us, go to our website. And if you have any more questions, I am happy to answer that. I have 10 minutes to answer questions. Otherwise, I can keep rambling about different chronic pain things that I've seen. And I want to see if I missed anything. I actually don't know if I did, but there's really cool studies, so it's neat. This is one of the first talks that I've ever given where a majority of the studies that I cited were just out of the last 2 years. So every year we get about 3,000 to 4,000 new cannabis studies, which is amazing. Practicing from 2019 to now, it's very different. There's so many more resources. And we are always trying to build that research. We're always trying to collaborate with different medical centers, with different doctors to see if we can do case series, if we can do retrospective studies. So we're always trying to build that knowledge out. We absolutely can help you in Florida. And again, thank you to Curaleaf for having us do these talks in the Rooted in Good program. So side effects. So actually, with lung health, what's really nice is in the studies we've seen, cannabis actually isn't as bad for our lungs as we assumed. So there's a lot of myths out there with cannabis care. A lot of them come from that era of the before time of not being legal. Tobacco smoke is far, 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 far worse for people than cannabis smoke. So there was a study that showed at 7 years of consistent cannabis smoke, at 7 years, there was no increased cancer risk. Tobacco, you do see that increased cancer risk. What they did find at 7 years, which was really fascinating, is actually an increase in lung expansion. And what's really funny, if you read the entire study, which I'll save you, there's a note in there where the researchers say maybe it's because the subjects really enjoyed deeply inhaling the cannabis. So they had no idea why this one metric was slightly improved. At about 10 years, it equals out. But with medical cannabis, I will say medical cannabis users aren't frequently consuming. They are not consuming hourly. It's every couple hours, and oftentimes it's anywhere from 1 to 5 puffs. So if you just even think about the consumption from a cannabis inhalant versus cigarettes, you're just not consuming the same amount. The other thing, I always say this disclaimer, so anytime you put anything in your lungs that's not room air, there is a little bit of risk, but that includes pollution, that includes smoked meats, that includes, hanging out in a race car track. With vaporizing, so vaporizing flower is one of the favorite modalities that I recommend quite often. The reason why is you get all those really good things like the terpenes, like all the cannabinoids, but it's a steam, so it's a little easier on the tissues, a little easier on the cilia. So the cilia is part of your respiratory tract that kind of catches things that it should and spits them back out. That's why we sneeze. It's also kind of cool is the same cascade that I didn't get into because I didn't want to bore everybody at 8 to 9 to 7 p.m. at night, is so there's something that tells our brain that we're in pain and signals our body to do things. They're called TRPV1 receptors, or the TRPV receptors. Cannabis actually acts on TRPV1. So what's really fascinating is when we inhale any kind of smoke, we signal that TRPV1, and that's actually why we cough. It tells our brain to cough. But the other reason is the cilia gets kind of filled with things that are not room air, fills with mucus, we sneeze, we cough. But pretty cool that the same receptor that helps with pain control, particularly in neuropathic pain, also makes us cough. So if you've ever taken a huge hit to use regular speak, TRPV1 is why you cough. So that's pretty neat. So vaporizing flower is pretty awesome. There are disposable vaporizers that I always recommend sometimes first to see, and so do my nurses, to see if, not my nurses, sorry, they're all lovely and brilliant too. So if you call us, know that we're all doing a ton of research. So nurses actually, this is why cannabis nurses, I think, are up there with clinically really robust with your critical care nurses, with your anesthesia nurses, your RNs, is because cannabis nurses, we have to read research, and so we know a ton of pathophysiology that you just don't typically get if you are a med-surg nurse. Of course you can, but we're not taught a lot of these things in nursing school. So if you're a cannabis nurse, you really have to be motivated to be self-taught, and you learn way more pathophysiology, so the study of how disease affects us. And these neuroreceptors more than some, advanced practice folks do. So cannabis nurses are great at this. So going back to vaporizers. So vaporizers, sometimes I recommend disposables just to see if it works, and to see if the person even likes that modality, because vaporizing flower sometimes can be a little bit of a buy-in. I'm getting told to wrap up, but if anybody has any more questions, do I have time for one more? I have time for one more. Or I can keep talking about how awesome our nurses are, which is fine too. The other reason why I feel like the cannabis nurse is just as equally competent as a critical care nurse, an oncology nurse, a lot of the nurses that have to do a lot of kind of extra homework, is we have to convince physicians that are sometimes scared of cannabis to not be afraid of cannabis. And this is no easy task because you have to speak their language. You have to be able to know, the things that you weren't actually taught in nursing school, and you need to be able to spit it back to them and be prepared for a lot of questions. The other thing that cannabis nurses are quite skilled at is, all nurses are skilled at this, but sometimes what we do is we already know the answer to the question, but we have to say what we want in the form of a question to kind of get the physician or provider to give us sometimes the answer that we want. So definitely, if you are a nerd like us, become a cannabis nurse. You will read lots of research, and then you could give talks like this on all the research. So I am out of time, so please follow us here on Instagram. Please follow our TikTok at Acute Chronic RN. I think that's my TikTok handle. And then Twitter, Acute on Chronic, Facebook, Acute on Chronic, and then www.acuteonchronic.com. We do work in all 50 states. Zoom, we have some nurses in person. And then we are based in Chicago/Evanston, Illinois. So tell your physician about us, tell your friends. We are happy to help you with your chronic pain. And we always like to see people have, really fantastic results. And I've been a nurse for quite some time, 13, 14 years, and this is by far the most fulfilling nursing job I have. Although I love my homies in the ICU, it's really nice to watch people get better, kind of as a surprise. Thank you again to Cureleaf and Rooted in Good. Follow us, and we are going to do more of these. And thanks for joining us. And we will be sharing this again, so tell your friends to, click on our Instagram, and we'll definitely be showing this on TikTok and Instagram. Have a really great night. Bye.